So this study looked at the impact of the ACA Medicaid expansion in its first 4 years of implementation on rates of uninsurance, in-hospital mortality, unplanned readmissions and return ED visits, and access to rehab among young adults, and at racial and ethnic and socioeconomic disparities in those. And we really found that Medicaid expansion in its first 4 years had a generally pretty positive impact on trauma care and outcomes among young adults. It markedly decreased uninsured rates and increased access to rehab. Those improvements tended to be greatest in the first 2 years of Medicaid expansion when the greatest gains in insurance coverage occurred. And those gains also were greatest among Black patients and patients from lower income communities. Overall, we didn't find an impact on in-hospital mortality, readmission, or return ED visits, but we did find disparities in in-hospital mortality between Black and white patients were significantly reduced. Further studies will really need to be conducted to identify the mechanisms driving these changes, but we definitely recommend and plan to pursue further studies examining long-term functional outcomes and really looking at geographic and hospital level characteristics that drove some of these improvements and reductions in disparities.